you kind of gave us the buckets earlier, and it seemed like maybe the second bucket of those who are using RHA and happy with it and kind of waiting for the neuromodulator to come so they don't have issues with their bundle. Seems like those would be people that kind of rapidly increase their use of both products once available.
Yeah, well, I think with the HintMD system, it's still early. Recognize that there's not 100% overlap between our HintMD accounts and our filler accounts. So we're in a subset of our filler accounts with the HintMD platform. And again, it's still early to kind of talk about trends and market share and everything, given that we've got a wide range, and some people are still working their way through their process of trying to figure out where it does fit in the practice. So I think as we get more towards the back part of the year, we'll have better metrics and more data that will help sort of inform our view on this and what we're comfortable sharing.
All right, thank you.
All right, thanks, Tim.
Thank you. Your next question comes from the line of David Amsellem from Piper Sandler. Your line is now open.
Hey, thanks. So on the RHA 2, 3, and 4, and I apologize if I missed this in your prepared remarks or other questions, you just talk about which of the SKUs you're seeing the greatest amount of usage, and just talk about, is there any sort of one that predominates or has gotten out of the gate the fastest? So that's number one. And then number two is on RHA 1. I know you talked about it being filed and the potential approval. I guess, what do you think RHA 1 adds to the overall portfolio, and specifically, where does it make the franchise more competitive, or what competitor products is it most analogous to in terms of where you think it can gain a foothold, if you will? Thanks.
Thanks, David. I'll maybe provide a couple of framing comments and then ask Dustin to add a little bit of additional color. In terms of the mix of the products, we did not cover that in the prepared remarks, but it's relatively evenly split between all of them. And again, what's interesting is you don't find a consistent pattern where all accounts use the same amount. Some people will say, I like 3 for this area, or I like 2 for this area, and it can vary based on kind of how the practice approaches things, what look they're going for, their mix of patients, are they younger, are they older? And so right now it's pretty evenly split. Over time, I would imagine that will separate a little bit. RHA 4 being sort of the heaviest of the gels is used deeper, and so in cases you sometimes see that when used, there's more volume that's used, whereas 2 being a little more superficial. It's a really nice product in that it moves very naturally and maybe not as much on a per patient, but might have sort of broader adoption on that. And then on the RHA 1 side of things, it will be a smaller market. It's for sort of peri-oral lines, so sort of fine lines, very superficial. But there's not really another product out there right now that is as unique as it is. And so while it will be a smaller part of the market, it's a differentiated offering that will certainly, I think, enhance the different products that we can offer, and frankly will give us a foot in the door too for some accounts where if they don't feel like the 2, 3, and 4 give them something that they can't do today, it will do that. And I don't know, Dustin, if you want to add color on what's closest to RHA 1, and then any other insights on 2, 3, and 4.
I think you hit it pretty well on our 2, 3, and 4. I think that's the uniqueness of launching them all at once. It allows us to create an opportunity for practice to utilize what fits best for them versus taking one product and kind of trying to get them to shove it down. You have to use this product. So I do think over time, 4 will likely be the larger product just based off of pure volume. But we've been very happy with how 3 and 2 have held up as well. On RHA 1, it's a bit unique. It has the same technology platform as RHA 2, 3, and 4, being the least modified, most natural. It also has the lowest amount of cross-linked RHA, lowest concentration, which allows the product to be used a bit more superficial than anything that's on the market today. That's what we're hearing from some of our colleagues in Europe. While it will be indicated in the United States for perioral lines, specifically there's other areas in which it's being utilized as well. So it should be a nice complementary addition. To Mark's point, that's a lower volume product. You're not going to use multiple syringes of that that type of product. And so it will just add that rounding out. And it also stands alone as something that isn't kind of available today. What they use for some of those products, or the main one would probably be Bobella, is where probably they're using the most superficial products. And then some other products like Bellatero and others, I believe, are using in some of those superficial areas as well, too. But we feel like it'll add a nice halo, as well as being able to leverage what is currently resonating in an innovative technology platform being least modified.
Okay, that's helpful. Thank you.
Great. Thanks, David.
Thank you. And your next question comes from the line of Jacob Hughes from Wells Fargo Securities. Your line is now open.
Hi, good afternoon. Thanks for taking my question. Mark, just Elegant Aesthetics announced a deal today to add to their offerings. Is there any additional areas you're looking to add to on an inorganic basis over the next 12 months? And then, thank you very much for the additional disclosure on the inspection. Based on your interactions with FDA, has there been any additional feedback on a potential label? Thanks very much.
Sure. Thanks, Jacob. So first, in terms of other areas, if you go back a little over a year, we were just a neuromodulator company, right? And so, we recognized that to effectively compete in the facial injectable market, that having a leading filler and a services offering, which we acquired in HintMD, was going to be critical to advancing this prestige strategy. Also, when we look at the overall facial injectable market, that's a sales force, that the same sales force that sells all those products. As soon as you start moving into other areas, skincare, breast, devices, you're talking about a different sales force. So I think we feel right now we've got the right assets to compete. We really like the facial injectable category. These are, billion-dollar plus categories in the filler area and in the neuromodulator area in the U.S. alone. And so, we feel we've got enough on our plate right now to focus and execute. And this year will be, very important that we execute well. Certainly over time, we'll continue to be open-minded if we think that, there's different products that would further advance what we're trying to build here. But for now, we sort of like how we're positioned in the facial injectable category. And then the second one, in terms of, FDA and any kind of, feedback on that side of it, we continue to feel good with the discussions. I'd point you back to our scripted comments where, we are hopeful that we'll get an inspection date in the not too distant future, and that we'll be able to, turn that around and get the product on the market shortly thereafter.
Okay, got it. And have they given any additional on the label?
I missed it. Yeah, so on the label, when we announced that we were not going to get approved on our PDUFA date of November 25th, what we basically stated was that, everything else had already been worked through with the agency, CMC, clinical, preclinical, and that the only outstanding item at that point was, the on-site physical inspection as part of the PAI. So, that's the last piece that we need to complete in order to get the product approved. And so by default, we feel good about, where we are with all the other pieces.
Thanks, Mark. Congrats on the progress.
All right. Thanks, Jacob.
Thank you. And to ask a question, you will need to press star 1 on your phone's keypad. Your next question comes from the line of Vamil Divan from Mizuho Securities. Your line is now open.
Great. Thanks for taking my questions. Maybe just to follow up on a couple topics you guys touched on. One, I guess, would be the migraine opportunity on the therapeutic side. I know for some time you guys have been saying it's sort of a matter of when you pursue that as opposed to if you can pursue it. I guess I'm just sort of wondering what you're waiting for, what's going to just make the decision to move forward. It's obviously a pretty large market, but also competitive and maybe more competitors coming. So I think you'd want to get to the market sooner than later. So just maybe you can share your thoughts on as you're thinking about that opportunity. And then the other one, just maybe more as you think about DAXI and sort of the go-to-market strategy, especially around pricing. I'm just curious if there's anything new or different in how you're thinking about. I know you've talked about potentially a premium product and maybe it'd be a premium price. Maybe anything more you could share there, given obviously it's been delayed a little bit, but it's also